talk about the SRHR services and other services to women during COVID time. The interviews that I did with some of the women, I was able to meet about 10 women whom I was very, very glad to discuss with what are their issues, and also they shared with me what are their experiences during COVID time and access to services. One of the most prominent issues that came out during these interviews was the fact that women had two-way experience of access to services. Where there was services, the health providers were not there, or the services were not accessible because of the high cost of transport. And where there were no services, they were not there. The services were highly, very, very accessed in terms of where they were not. Where they were not, women shared and said the services trying to get the right word. The services were not even there, because some of them actually went to get them and they were not able to get them because of very many reasons, which especially the country, when the country went in total lockdown, where we could not access transport, and even the providers, health centers, where some of them were closed down. In fact, most of the women were actually accessing self-treatment, I would say. So as I talk now, we have a lot of COVID babies. Women got pregnant because they were not able to access condoms and even other family planning services. And those who were able to get the services, they measured issues around to do transport, because the transport has been very, very, it has been very, very expensive. Our transport in the country has been doubled. And another issue that was raised by the women was the fact that those who own treatment, the ARVs, had issues to do with lack of food. We know that when the lockdown came, very many things were also locked down. The pockets, the money was locked from people. Like, people could not have money to buy food. So it was very hard for women, but I want to thank the friends